Good morning. My name is Andjelka Mihajlov, Advisory Board Member of the Air Pollution Scientific Initiative. With this interview, taped on June 23rd, 2021, intention is to open the box of the air pollution consequences to health as the added value to air pollution science. I would like to thank Professor Zorana Andersen for her agreement to be interviewed for APSI portal. I will talk with respective scientists in mentioned field, and as the beginning, I'm asking Professor Zorana Jovanovic Andersen to tell us summary of her professional career. Please.
Thank you very much, Andjelka. Pleasure to do this interview with you. My name is Zorana Andersen. I'm a professor in environmental epidemiology at Copenhagen, University of Copenhagen at Institute of Public Health, where I have been leading a group in environmental epidemiology in the last 3 years, where we conduct mainly studies of health effects related to air pollution, but also more and more look at multiple exposure to several pollutants at a time, and here noise and air pollution exposure is very relevant to look at, as well as green space and other exposures. My career background, how I came to become environmental epidemiologist and air pollution epidemiologist, it's a very different path to becoming an air pollution epidemiologist. I have studied bachelor in biology pre-med at Youngstown University in Youngstown, Ohio, in the United States. That led me to a master degree in biostatistics at a graduate school of public health in University of Pittsburgh, which closely collaborates with University of Pittsburgh Medical School. And this degree, with specialization in biostatistics and strong part of epidemiology, has led me to later career in epidemiology and air pollution. And after moving to Denmark at University of Copenhagen, I continued studying biostatistics and then started working in applied project within air pollution epidemiology. And I did my PhD in short-term effects of air pollution in Copenhagen, where I looked at day-to-day variation in air pollution and admissions for hospital for cardiovascular diseases and asthma in children. That was now more than 15 years ago. And after that, after specializing and really becoming air pollution epidemiologist through my PhD, I continued working in this field in last 15 years. And I worked a few years at Danish Cancer Society and their famous Danish Diet, Cancer and Health cohort, which is part of EPIC cohorts, European EPIC cohorts, where we did the long-term studies of air pollution and collaborated in a couple of European consortia with that cohort, escape studies. And last few years, or more than 5-6 years, I'm back in University of Copenhagen, where I'm PI on the Danish nurse cohort, where we do also a number of studies of health effects based on that. And we're part of a labs consortium and a number of other consortia and do a lot of nationwide studies also in Denmark. So that's briefly about how I became air pollution epidemiologist.
Thank you. Now we see that we have a really proper person to talk about air pollution health effects. And please tell us a little bit more of consequences of air pollution to health.
Yes, I would also like to point out that beside of my work as an epidemiologist and producing a lot of studies on health effects of air pollution, and I worked with many outcomes, and I'll recap. I'm also chair of European Respiratory Society Environment and Health Committee, and European Respiratory Society has the long tradition in being concerned about air pollution as a risk factor to lung disease. And in that role, I also do a lot of advocacy work and translation of knowledge to policymakers. So it all starts with lung, of course. We inhale air as our main function, condition for us to live. And by inhaling air passively, we also inhale a lot of substances in the air that are not supposed to be there. And those are a number of gases and particles which enter our lungs. So the first understanding of the health effects of air pollution, of course, was on the lung. Air pollution contains a number of particles and gases that can cause inflammation in the lungs. And inflammation is the main mechanism how air pollution affects our health. So earliest research has noticed that air pollution irritates, obviously, respiratory lung patients, patients with chronic obstructive disease, asthma patients, children with asthma. Those are the ones that are most kind of immediately responding to air pollution. We also in the last few years know that air pollution is carcinogenic, and lung cancer has been linked to air pollution also very convincingly. While we are at the lung now with COVID-19, we also became a lot aware of infectious diseases and what threats they pose to us. And we also know that air pollution affects our immune system and compromises our ability to fight infectious diseases. So air pollution also increases risk of contracting pneumonia, influenza, and likely also COVID-19. And we have a lot of research ongoing to find exactly how that happens. Besides lung, we also know that air pollution can travel from lung after the small particles are inhaled in lung. They can travel through alveoli to bloodstream. And through bloodstream, of course, air pollution affects our cardiovascular system, increases risk of cardiovascular disease, ischemic disease, stroke, and the latest evidence on cardiovascular disease shows that air pollution also increases risk of arrhythmia in the heart, atrial fibrillation and arrhythmia kind of diseases, as well as heart failure. So there's a huge burden on cardiovascular disease, as well as some of the newest evidence. Now we know that air pollution via bloodstream can really reach all organs in our body, and it also more recently, just in 10 years, last few years, we have convincing evidence that air pollution affects metabolic diseases and increases risk of diabetes by causing systemic inflammation, low-grade inflammation in our fat tissue and into our body. And some of the latest research now shows that air pollution also can affect our cognition and increase risk of dementia and or kind of accelerate cognitive decline related to aging. So we have a lot of now research on brain diseases and dementia, but also psychiatric diseases, depression, and so on. Another very important aspect with air pollution health effects is to really think about most sensitive populations. Not everybody is equally affected by air pollution. Here, children are most maybe precious population that we have to protect from air pollution, and we know that air pollution is already affecting unborn children through pregnant mother, for exposure to pregnant mothers. And we know that children from mothers that are exposed to high levels of air pollution are born with lower birth weight, and that automatically sets you back in life, and it increases risk of a number of diseases. We know also that children that are exposed to air pollution have increased risk of asthma and likely also have this effect on cognitive development and maybe have slower cognitive development and risk of related diseases. So children are really a very sensitive group. Very much so also pregnant women for obvious reasons, and they can also pose health risk to pregnant women, increased risk of pregnancy-related hypertension and diabetes in pregnancy and those kind of complications for women. Elderly and people with chronic diseases are also even more sensitive to air pollution and a group that is very sensitive. And finally, also there's a lot of focus now on inequality in health, and we know that also groups that are socioeconomically disadvantaged are both more sensitive to air pollution. They have poorer lifestyle and maybe smoke more, drink more alcohol, eat more poor diets. So they are more exposed already to a number of chronic diseases that air pollution also causes. So there's some synergistic effect with air pollution with other risk factors that they have more of. But also the most disadvantaged populations are more higher exposed to air pollution. They usually live in poorer housing, closer to busy roads or industry, close to sources and so on. So there's also a lot of focus that air pollution affects even more those that are already disadvantaged and hardest hit.
Just to ask you, could you tell us a little bit more what are the main pollutants leading to the health effects? Especially this is very important for air pollution science and for my personal interest on environmental engineering science.
Yes, as we know, there's many air pollutants in the air and that we distinguish, but were chemical and physical properties. In air pollution epidemiology, the air pollutants we have studied the most, that we have good prediction models or good measurements, are mostly nitrogen dioxide and nitrogen oxide gases that are mainly related to traffic-related exposures in the cities, and particulate matter. And here we talk particulate matter, fine particles, particulate matter with diameter less than 2.5. Or PM 2.5 is something that we have most solid evidence now, and we know that particles cause inflammation, as well as they have been established to be carcinogenic by EARC, International Agency on Research of Cancer, has a number of reports on both particles and diesel exhaust being carcinogenic. So those two pollutants, we know that they are most important, they are important, but we have most solid evidence for them. That they cause health, and we have also regulation of these in legislation in Europe and US. When that is said, we also have a number of pollutants that we're concerned of, but we just lack the data. And here, ultrafine particles, so particulate matter with diameter less than 0.1 micrometer. They're much smaller in number and likely maybe have bigger surface area where they can cause inflammation and oxidative stress and so on. Toxicologically, we understand that they might be and should be probably most harmful, but we lack epidemiological data because these are not regulated. So we know most about PM 2.5 and NO2, nitrogen dioxides, to be relevant for health, but we also lack knowledge on other pollutants that likely may need to be regulated and pose adverse effects, but we simply lack data. But we are seeing, of course, more and more studies and are keeping an eye.
From your angle, do you lack some data from air pollution science?
Do we lack some data on air pollution? Yes. So air pollution epidemiology is the field that links exposure data to air pollution to health data. And a big obstacle in many countries is to get access to good predictions of what are people exposed to air pollution on an individual level. I mean, that's the key. The best studies are the long-term studies where you can assign exposure to individuals to be able to follow them in a cohort design, as we know well from other areas, if we're studying smoking or diet or alcohol and so on. Most countries have very few measurements, so we need a really good predictions model, complex statistical models that predict air pollution at people's address and so on. Some countries, mainly Western countries in Europe and US, have resources and have developed these kind of models, but we acutely lack this data, for example, in Southeastern Europe, also in China and India. Now, last few years, we're seeing increase in studies and resources to have this, but generally in many countries, also in African region, Latin America, where problems are high, and Eastern Europe, we lack this research and good prediction models to be able to do good health studies. So that is the problem. And I mentioned ultrafine particles. We generally lack the data. Usually legislation is based on that we have enough evidence that something is dangerous. But on the other hand, if we don't have legislation, then we don't have measurements on something that could be dangerous. So that's kind of catch-22. We have the ultrafine particles right now. It's hard to get data if we don't measure them, but it's hard to get funding for measurement if we don't show that they're dangerous. So those are some of the gaps in the knowledge. I would also like to mention with respect to sources, most of the research has focused on traffic-related sources because that has been most easy to quantify. We could use count of the cars or distance to busy roads or to kind of get a good idea of how people are exposed to traffic-related air pollution. But something like biomass burning for heating, for example, we know it's a huge problem. Also in Eastern Europe, burning of wood and coal at homes, it's a huge problem, but these are very hard to quantify. We don't have registers or data sets of which households have these furnaces or cookers, and so those are some of the obstacles in being better to quantify health effects related to some specific sources, such as cooking and heating by wood and coal, and other sources as well from agriculture and so on. So we definitely have uneven knowledge, most about traffic and less about other sources that are also very important and likely just as harmful for health.
You already mentioned regulation, and I just would like to ask you, what is your feeling? How is science influencing the legislative frame, or opposite? Is it going along, or it is something is going behind, or what is your opinion about the scope, how much we regulate it and how much is science contributed to that?
Well, we like to hope that science, that our legislation at EU level right now with European Green Deal, we have some serious commitments to evidence-based regulation. When that is said, that's our hope, and we're feeding the knowledge. I think we're doing our part. We still have legislation that is not doing enough. At EU level right now, we have PM 2.5 level of 25 micrograms per cubic meter as our limit value. And we know that most EU countries right now and western part of Europe comply with this. But we know at the same time in last 10 years, we had a lot of evidence, a lot of new studies that focused on the areas with levels below a current EU limit value to show that we still have huge health effects. So we have legislation that is not protecting our health. So there's a lot to be done. And I think that I hope that future legislation, and I think there are some serious commitments, and we're very excited now to see with Green Deal, with zero pollution action at EU level, and some commitments in the upcoming air pollution directive revisions coming up in 2020, whether this newest knowledge that we have now in the last 10 years, and there's really been very good quality studies at very low levels that show that we still have serious health effects, and that we need to really go much lower in limit values to protect health. I'm optimistic that some of that will be used and the legislation will be stricter. So there's a lot to do to incorporate evidence in legislation, but I'm optimistic, but let's see.
There are a lot of talks. Now, next year is the 50 years of United Nations Environmental Program, and they also have some kind of ideas or pre-commitments to do something very crucial. And it is really some kind of promising that science will be listened in that respect. And I just would like to ask you one more question. This is very important for the people listening this on the APSI portal, is what do you see as the biggest challenges for air pollution science from your angle? Your angle is health effects of air pollution.
Yeah, that's a very good question. Well, I live and work in Denmark, where air pollution is relatively low compared to Belgrade, where you live. But still, we have big misconception, and I think still people are just not as aware of air pollution being so dangerous for health. I think we have failed maybe in risk communication. Everybody knows smoking is bad for you, and alcohol, and that we should be eating a little bit less, and that maybe we should watch our weight. But air pollution is it's been a little bit abstract. It's something that we measure in the air. But I think we fail a little bit to link it as a public health risk factor. I think that's been really a big barrier. And even now when we talk about health effects and politicians say, well, let's do more measurements. And we can measure more, that's really good, but we really need more health studies. We really need to communicate that this is health risk factor aligned next to, and we need to have strategies how to deal with air pollution as we do in any public health strategy of any country, how we deal with smoking, how we deal with obesity, how we deal with alcohol problems, and so on. So I think that's one big barrier why maybe hasn't been done more, or maybe why people are not prioritizing more. Another challenge is I mentioned more kind of related to type of studies and also funding. It's quite difficult to get funding, and I think this goes in acknowledgement of the problem, right? And I think there's a lot of myths now in Denmark, you don't, on the days where you don't see or smell air pollution, there's been a little misconception that it's not dangerous if if it's not obviously there, like in cities where you have big episodes of air pollution. And so I think we have maybe failed in communicating better how large are the risks in air pollution to do more about it, or maybe generate public interest and public pressure on politicians to do more about it. I think that's one very important aspect. I think there's also opportunity, and we can do more about it. I think also we talk a lot that clinicians have a big role, I think, in educating doctors and medical studies. Again, all doctors and all patients and citizens know about smoking and classic risk factors, but not about air pollution. So I think we need to also educate our medical community more about air pollution. We're doing that to European respiratory societies, to respiratory clinicians, but now we see we have a range of diseases pretty much through our lifetime, from pediatricians to cardiovascular disease researchers, oncologists, that they should be aware of air pollution. It's really an important risk factor. So those are some of the barriers. I think that maybe we haven't been better to generate more interest for political action, maybe. I also see a opportunity. I think we also have been maybe too passive and poor to communicate that there are real opportunities now when we're facing climate change. We're facing, issues in our cities with urban planning, with having too many cars on the street. That we can really solve many things in solving climate change. The fossil fuels are the main causes of air pollution, main drivers of climate change. There's really the same policies that can solve both, and with solving, investing in policies that go away from fossil fuels and investing in renewable energies and building cities with less car oriented and pushing public transport and promoting biking and active transport is not just solving air pollution, but is also helping us live healthier and maybe get more physical activity. And I think we also need to think about more these systemic solutions that solve many of the current challenges we have in big cities, and also sustainable developmental goals. A lot of them have air pollution indirectly in them. So I think maybe we have missed to really serve the opportunity to solve air pollution along with other challenges we're facing with climate change and the way we live in our urban environments today.
If you allow me to add something, in environmental science, in air pollution science, prevention is the main thinking when you start to develop something. And I would like to add that it is important not to educate just medical people. It is very important to educate all people in the area dealing with planning activities of cities, with all kinds of engineers, natural sciences, meteorologists, because if you cut the trees in some cities, you don't have a corridor for the wind. For that, and all kinds of people, it is important to be educated in the simple consequences of environmental and air pollution, and the opposite, the medical doctors should be educated about this link between air pollution and consequences to health. And I find myself that we are in the same pot. This kind of interdisciplinary science are really trying to find the way to be recognized, and at the end to finance this kind of research, very important for development.
Yes, I completely agree with you. I think we just fail to inform, and you can wonder, okay, smoking, and we see a lot of prevention of smoking or alcohol. It's only part of populations that are affected with that, right? And it's very difficult to change people's lifestyle, but air is something we all breathe. Nobody can choose not to. If you think about it, it should be a human right in some way that our environment is fixed. So there's a huge prevention possibilities, even just doing a little bit about air pollution. There's so many. If disease is affected, everybody's breathing air, everybody's exposed. I mean, you rarely have exposure that reaches so many people in any other public health arena where you're trying to prevent disease. So I agree with you. Prevention possibilities with air pollution are huge and missed often. And when you do this cost-benefit analysis in how much you would save of lost lives or hospital admissions or sick days for parents and children, it's a no-brain benefit in doing something about air pollution. I think we talked recently, there's most cost of not doing anything about it, right, to society. So I think that's also something that should be communicated better, and prevention is the key issue, how much we would prevent by doing something about air pollution.
I think this interview is very interesting topic, and I would like to thank you for sharing with us the possible health consequences of air pollution. And I think who is listening this interview could learn something, and at least to have awareness on issue. And just I would like to give you one more opportunity to some final message.
Yeah, so I think with air pollution research, I think we have really, as I said, the health effects of air pollution are huge. And in the last 20 years, we realized they're much larger than we know. I think we went from lung to a number of other diseases. There's a no-brainer that there's a lot to gain in health by doing something about it. And now that we're also facing climate change and SDGs are putting focus on urban development, and we cannot ignore anymore all these difficult choices we have, I think it's a maybe good opportunity to set really air pollution on agenda again and really do something together with these other challenges we face. So I think momentum is really good. We have enough science to have evidence-based legislation that I hope will work for better health of all of us. This is really a public health issue, air pollution, not something detached from us and humans in our health. So that's my main points.
Thank you very much, Professor Andersen.
Thank you, Andjelka, for inviting me and also for doing your part to inform more about air pollution. It's been a pleasure.